Assalamu alaikum. This is a patient aged 50 years old. He had a surgery, abdominal surgery 2 years ago to remove cancer. He did a rectosigmoidectomy. No available previous imaging. Currently the patient is complaining of abdominal pain and hematuria, and the main purpose of this study was to assess the cause of hematuria. That's why we do the multiphasic kidney protocol to detect any soft tissue lesions in the kidneys or the collecting system. In the non-contrast phase, we have here there is no renal stones and urinary bladder is empty, CQA2 catheter. However, there is intraluminal hyperdense stone. We can measure its density. It's about 60, so it is a hematoma. However, full assessment of the wall can be done on a collapsed lumen. We will revise the arterial phase, venous phase, and nephrographic and delayed phases on the kidneys, and the conclusion was there is no soft tissue lesions. So let's go to the other incidental findings that we can see here. There is a left adrenal lipid-rich adenoma. Left adrenal myelolipoma. It is a fatty lesion in the adrenal gland, myelolipoma. There is an enhancing lesion at the anterior perineal space. It could be metastatic nodule. And there is something in the left lumbar region. We will discuss it later. And let's give a look on the urinary bladder. Actually, there is no mural lesions on such a study, so we don't have an explanation for the hematuria. Let's go back to the anterior abdominal wall. We can see there is a colostomy here with underlying hernia, non-complicated hernia. There is no bowel distension. Now let's check this structure. It is sharply demarcated, well-defined structure. Noted an extraperitoneal space. It has a linear marker inside it and contains multiple air foci. This is a classical sign for what we call a missed towel or Gossypiboma. You can make a MIP image so you can see the marker of the missed towel. Here it is. And you should be familiar with this appearance, because once you saw it once you will always remember it. تشوفها مرة واحدة بس في حياتك مش تنساها أبدا. Structure well defined, filled with air foci, heterogeneous air foci, and internal linear marker is a missed towel. Once you start reporting, you will mention in the first paragraph your answer about the primary concern of the study, the urinary bladder and hematuria. Then you will write another paragraph about the very important lesion, which is the Gossypiboma. Well, before you deliver the report to the patient, you need to call your colleague and inform him about the result, so he can manage the situation. It is somehow a medical legal situation and must be carefully handled. كلمه تقول له زميلك والله يا فندم كذا كذا وموجود Gossypiboma it is a missed towel and you should manage this case carefully. ده حق زميلك عليك. تمام. بعد كده هعندنا هتكتب بقى بقية الباراجراف. You will write the rest of the findings, size of the enhancing nodule, mostly it is metastatic peritoneal deposit. Also we will describe the rectosigmoidectomy and left paramedian colostomy. By the way, I forget to show you an important findings. This famous finding, you will find it in any patient who made an surgery in the pelvis, mainly at the rectum or sigmoid. The presacral fluid collection, which could be mildly enhancing. This is a post-operative accumulation or accumulation of fluid, mostly lymph or granulation tissue. وغالبا بتقعد فترة طويلة، بتقعد سنين موجودة. It lasts for a long time. In this location is the presacral space. Nothing to be worried about, but you should be familiar with these findings. لأنها برضو أوقات sometimes it is show hypermetabolic state in the PET studies. بس لكن دي is not a metastatic lesion or a neoplastic lesion. ده الكيس، لازم تبقى متعود عن انت تشوف الجوزيبايبوما. وانت شفتها مرة خلاص انت هتفضل طول عمرك فاكرها. طبعا انت ما بتشوفهاش كتير، يعني ممكن في السنة تشوف حالة او حالتين، لكن لو انت مش عارف ايه هي الجوزيبايبوما يعني هتفضل تلف وتدور يعني على نفسك مش توصل لحاجة، هتضيع وقت طويل جدا. انت مجرد عرفتها خلاص مش هتنساها ابدا. في الديسكريبشن بتاع الفيديو هتلاقوا لينك للدايكوم فايلز، وهتلاقوا لينك للريبورت لو حد فيكم حابب ان هو يشوف الحالة باستفاضة اكتر. يلا الى اللقاء.